So my name is Alexea Gaffney. I'm 40 years old. I'm a mom, an infectious disease physician and consultant, a speaker, an author, a health and wellness coach, and all of that came out of my diagnosis of breast cancer. So I was diagnosed with stage 3 breast cancer at the age of 37. And when I talk about my breast cancer diagnosis, I usually tell people that it was 2 years in the making. It wasn't, an immediate finding of a lump and then I had breast cancer. I found a lump on a routine self-breast exam at 35. Took it to my primary care doctor, had immediate imaging, which was a breast ultrasound, and there were some concerning findings. So I was referred to a breast surgeon and had a lumpectomy. On the pathology from that lumpectomy, there were 3 types of abnormal tissue found, and at that point I learned that I was at high risk for breast cancer. I got breast cancer screening every 3 months over the next 2 years. And sometimes it was just imaging, sometimes it was imaging in a biopsy, sometimes it was another lumpectomy. But every single time it was always a scare, is this the time cancer gets me? I had a routine follow-up with my breast surgeon who ordered a breast MRI. That breast MRI is what showed the large mass in my right breast, and that was ultimately what led to my diagnosis of breast cancer. So I had an MRI-guided biopsy, and 5 days later it was confirmed that I did indeed have breast cancer. And I had a brief moment of barely crying, barely any tears. I was just kind of in a weird place of emotional numbness because I knew I was going to be told, but I was still holding on to that hope that it wouldn't be cancer this time, because so many other times it wasn't, and I was trying to avoid it in the first place. And I just sort of focused on the fact that I knew, in a sense, what I would have to do to just get on the other side of cancer, and that's just where I immediately focused all of my attention. So when I got my breast cancer diagnosis, my breast surgeon actually wanted me to come to the office in the next hour. And it was very thoughtful to have him want to take action that quickly, but I declined because I didn't want to do anything alone. So I kind of gathered my troops, which was my sister and my 2 best friends, and said, listen, I need you to come with me to the doctor tomorrow. I just got diagnosed with breast cancer and we need to talk about a game plan. I knew in my mind already that I wanted to have a bilateral mastectomy, but I went in still open-minded and heard all of the options that I had. What immediate things is this going to impact, and what long-term things is this going to impact? So when I met with my surgeon, the recommendation was to have just a mastectomy on the right side. And I chose to have bilateral mastectomy. And the conversation around reconstruction was pretty immediate. For me, I knew that I would want to reconstruct. I hadn't considered anything else. And so that was part of our very first conversation around surgery, was whether or not I wanted to pursue reconstruction, and how I wanted to go about the reconstruction. He sort of laid out all the options, and he did really good as far as drawing pictures and explaining things in detail, as well as explaining that I would need to meet with a plastic surgeon who would work with him. And it was just always part of the conversation. It was as big of a part of the conversation was in terms of, introducing that I would need to have chemotherapy. It seemed to be presented with equal weight and equal importance, and that was important to me. And a lot of things got rushed, and I was glad that, it just held the same importance for everybody, or at least that's the way it was presented to me. More than anything, just having the people around me that I loved just taking care of me and taking the time to learn what they needed to know to help me in my recovery was more important than kind of anything else that was brought to the table.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.